CareAsOne is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipty Desai.
Hello, everyone. Welcome to the Future of Health with CareAsOne. I'm Dr. Dipty Desai, CEO of CareAsOne and the host of this podcast series. For those that are new to CareAsOne, it's a large virtual community that jumpstarts innovation acceleration by bringing together various stakeholders in the care cycle, from providers to payers, pharma to life sciences, clinical researchers, startups, investors, universities, and more. The mission of CareAsOne is to accelerate adoption of innovation by creating this connected healthcare community where the patient is at the center of care. And this entire ecosystem comes together through knowledge sharing with the help of healthcare luminaries and thought leaders to discuss the challenges, the gaps, the solutions, and transformations that are essential to make healthcare whole again. This interaction and networking between the stakeholders is made possible through summits, webinars, roundtables, leadership circles, and podcasts. So our guest for today's podcast is Unmesh Srivastava, and Unmesh serves as the CTO and Chief Digital Innovation Officer at Clever Care Health Plan, where he leads everything from technology, data and analytics, to digital enablement. Unmesh has also previously served as CTO at P3 Health Partners, and he has also led innovation and business transformation at Optum Care, California. He's also consulted at enterprises like Kaiser Permanente, Toyota, and Verizon, to name a few. And he holds a BS in electronics and communication engineering and an MS in engineering management. So it's good to say that his expertise lies in management of AI, finance, and entrepreneurship. And he follows a people-oriented and a team-centered approach to make this happen. So it's really cool. And his vision centers around data-driven solutions and cost-effective management of population health. So please join me in welcoming Unmesh.
Thank you, Dipty. Thanks for having me on your podcast.
No, it's our pleasure. And just to let everyone know, the podcast today that we are having is on building a patient-centered healthcare system. And Unmesh will discuss some of the challenges and some of the opportunities, the gaps and solutions, noting what is working and what is not in today's world. So welcome, Unmesh, and let's just jump right into it. It would be great if you could talk a little bit about how your past experiences have put you front and center of healthcare. You've seen it all firsthand. Can you elaborate on some of the challenges that you've encountered in building a patient-centered healthcare system?
Absolutely. So tons of experiences working at the grassroots level in healthcare. I think for all the entrepreneurs, executives, folks who want to work in healthcare and folks who are working in healthcare, it's super critical to, at some point in your journey, be deeply involved at the grassroots level where you are seeing actual patient care being delivered in different settings, right? It can be outpatient, it can be inpatient, it can be, pharmacies, labs, and whatnot. But I think once you see that firsthand and you work closely with the providers of the care and the consumers of the care, you will identify so many challenges that exist in the system today. Some of the things that I see at a macro level, it's obviously you see our healthcare spend, right? That you start with that, and that tells you the story here, right? We are spending 18% of our GDP on healthcare, which is crazy if you compare it to, it's probably the spend is higher than some of the large economies of the world.
And the outcomes are not that great.
And
Right?
outcomes are not that great. So, I mean, you and I sitting here talking about the problems, there are so many of them that need to be solved for in order to manage this healthcare spend and have better outcomes, right? Um, as it relates to patient care, I mean, there's bunch of things, right? There is one is access to care. That's a huge issue. To get in front of your PCP still takes you weeks, leave alone like getting in front of a specialist. So we say that our healthcare costs are high because our ER admissions are high. A lot of times the patients, they don't have any other venue except the urgent care and the ER to show up at a healthcare system, right? So access to care is hugely driving this. There's the administrative side of healthcare. There's just so much administrative compliance and regulatory burden on our providers, and everyone fairly involved in the healthcare system, that a lot of their time, energy, and resources are spent managing a lot of that regulatory compliance and process heavy healthcare that we have built. That takes time away from patient care, from actually seeing the patients, right? You go in front of your doctor and they're just typing away in their EMRs, or if they're not, they're talking to you, but then they're spending 3 hours of their day, end of the day, to make all of that data that they have to enter, coding, billing, all the different audits they have to go through. There's just so much pressure on our providers that that ultimately impacts patient centrism and patient care. So there's so many different problem statements, lack of data, lack of interoperability, lack of cost transparency across the board, getting these bills that you have never thought that you're going to get, and now you can't change anything because the insurance companies and the providers are chasing you to pay it. There's just so many problems, which I think is also the opportunity, right, for both large and small health systems, startups, and entrepreneurs who are looking to get into healthcare. The fact that there are so many problems that need to be solved, it needs disruption, and that's the opportunity for anyone who wants to drive innovation forward in healthcare.
Yeah, no, you just said it all. There's so many different challenges in there, from administrative to regulatory to access to technology adoption, and which ones to tackle first. It's just difficult to transform healthcare. But at the same time, we really need to do it because these challenges are real, and there's a lot. I mean, healthcare needs to be regulated, right? So if there were some examples that you could give on how to overcome some of these difficult challenges that we have, and how can we maneuver through these landmines? Because at the end of it, it's something that providers, like you said, are very passionate about. They want to give care, right? But at the same time, there's a lot of oversight, and there's a lot of regulation. There's a lot of administrative tasks that they have to do. They have to make money, but at the same time, they need to save money so that the organization can exist, right? So can you tell a little bit about how you managed to maneuver through some of these landmines?
Yeah, still maneuvered and still maneuvering through a lot of these landmines. I think anyone who has been deeply involved in healthcare for some time knows that regulatory and compliance is it's a necessity in healthcare. I feel like it is sort of overly regular. There's over regulations and compliances that we have built, but there's a rule book to that, right? So, and there are different ways of how you see it, right? I'm gonna just give you my technologist lens here. We guys are big on HIPAA and high trust and making sure that the health information is protected in a way that you can manage large levels of PHI information. So one of the things that I do going in when I'm looking to drive tech enablement or transformation is having regulatory and compliance as one of the verticals in everything we do. So, we work very closely with our compliance officer. We have cybersecurity officer as part of our team. Who is constantly looking at data loss. We look at certain different types of procedures, right? Whether it be identity access management, whether it is data loss prevention, whether it is data encryption, decryption standards, whether it is looking and doing, ongoing penetration testing. Our goal as a healthcare organization is to be HIPAA compliant at all times, but at the same time, from a compliance perspective, we always shoot for getting a high trust compliance certificate, right? Because when you are high trust compliance, you ought to maintain an ecosystem which is secure, and that's just one of the pieces of how we manage this. But some of the other challenges, like you talked about, right? Access to data, like data and analytics is a centerpiece of everything you do in healthcare, right? So making sure that we define a vertical within our technology teams, which is actively managing data warehousing, managing analytics, innovating on AI, and how you convert that data into information. How do you ingest data which is not structured into your ecosystem, contextualize it. Something as basic as defining a member or a patient, right? Because there are so many data silos, you would get a Dipty Desai, which will be spelled differently and has different addresses from 5 different health systems. So us as payers, we have to deploy enterprise data management and master data management, where we are defining our own like master patient index to really define who Dipty is, because I'm getting Dipty's data from 5 different sources spelled differently, even though it's the same Dipty, but it's hard to combine it, right? So something as basic as that, we make sure that as a technology leader, I put that on my roadmap and as an integral part of my team. And it's a structure to manage it that way.
You're right. There's like a data war going on. Everybody wants to own the data. At the end of it, the data belongs to one individual, and that data comes from a lot of different sources. But those sources are not integrated, and there's reasons for that. So to transform to a patient-centric approach, like what you would want to do, you really need to have people come together and make changes.
Sure.
And if that needs to happen, can you talk about, like, if there were one way of doing it, what would you suggest? How can we all work together to make this happen? Because at the end of the day, it benefits everyone.
Yeah.
But at the same time, it means giving up something to get there.
Yeah, no, it's really, we as organizations have to think about just lowering the guard on, hoarding patient information and saying, this is my member. There's a member or patient war going on. You talk to a payer will say, this is my patient. And then you go to the provider or PCP, says, this is my patient, and he or she is on my panel. You go to a specialist, a lab, they'll all say that this is my member, which is like completely opposite of how it should be. Part of this push is by the rule given out by CMS that health systems have to make sure that they share the data back with the members, right, in a seamless way, in a very structured way, through member portals, through different APIs and so forth. And then the phase 2 of this will be that health systems within themselves have to share data in the FHIR format with each other. So there's interoperability. So there's a push down from the government to do this. But at the same time, like, the adoption of this FHIR standard has to be left, right, front, center in minds of all the health systems. one of the beautiful things going on right now with all these challenges is that there's a lot of like underground plumbing going on with some of the big tech, which is being involved in healthcare now more
More.
increasingly,
Yeah.
right? So I would suggest, you go on your Apple Health. If you're an iPhone user, go on your Apple Health.
Yeah.
And that's right. So go in Apple Health and look up your medical records. One of the things which is sort of a revolution going on, which is not talked about quite a bit, but it is happening at a very fast pace, is that a lot of these health systems, hospitals, labs are now participating in the FHIR APIs which Apple is putting together. So now if you as Dipty go to one of the labs nearby, or you're going to a hospital, or primary care is still something that needs to be integrated more deeply in this, but a lot of different health systems are participating and sharing data. But they'll still, I still feel there are ways to go on this, right? HIEs, right? The whole promise of HIE or Health Information Exchange was to make sure that all the hospitals participate. So when you transition into acute care, or you transition out of acute care, your data flows in and out from this health system, right? Or from the hospital. But HIEs are still a work in progress in last decade. Right?
No,
So
I mean, you're right. We've seen a lot of changes in the last 10 years, but still not enough, right?
still
Like
not
you
enough.
mentioned, we want to see the person and follow the person longitudinally from when they're normal or not having a medical condition to having the medical condition and getting out of it and getting back better and so on, right? Until the next episode happens. But we can't follow them fully because all of that data is not integrated. This is still a challenge. Like you said, the exchange needs to do a lot, but it's not happening. But that's good. Those challenges result in opportunities, right? And
Right.
and healthcare organizations can now leverage these emerging technologies, AI and data and analytics, to improve patient outcomes and reduce costs, right? So maybe it might be time to jump in and say, okay, so these are some of the challenges that we have. Now, these are the opportunities. How can we leverage these? Can you kind of elaborate a little bit on that, and how data and analytics and the large language models, the generative AI, all of that, how is that helping us or can help us?
There's a lot of buzz around large language models these days, so it'll be great. We'll talk through that as well. But I think you start with data, right? So at least some of the forward-looking, you know, positioning by health systems, health plans, payers, providers, labs, pharmacies, hospitals, is to be involved in sharing data to some of these centralized entities, like HIEs and so forth. One of the things that I usually tell both startups, large organizations, which are doing, like, there's a lot of investment going on in the world of data, just data in, if you remove like large language models and, machine learning, deep learning, they're all great. They sound great, but the bedrock layer of all of that is data. And healthcare at this point, it's still struggling to get all the data together, whether it be centralized or decentralized or whatnot, but getting the data contextualized is still an issue. So I feel like a lot of different health systems, entrepreneurs, startups, data is now on the focal lens of everyone, right? So doing a lot of work in this direction, where you as a health system, like I can tell you what we are doing at Clever Care, is we are ingesting data from hospitals, from labs, from outpatient organizations, outpatient providers, inpatients, HIEs. We are also enriching the data for what we don't get, because if you see what a lot of people have been seeing through the pandemic and post-pandemic, is a lot of your clinical conditions, like there might be an underlying medical reason for that, but there might be an underlying social reason for that, of why your disease is progressing, or why you are heading out to the ER, or why your health is deteriorating and you're getting multiple comorbidities, right? So what we do at Clever is we ingest data from all these different sources. We normalize it into what we call Clever Cloud, which is our data warehouse. And then we are now working on enriching that data with things like social determinants, cultural data. We are enriching a lot of demographics data, which we do not get. Like, you'll see something as basic as phone number and address is different if you go to different health systems, right? So we are doing a lot of data enrichment there. But you start with that. Like, that's the bedrock layer I tell to everyone, is fix your data before you think about business intelligence and artificial intelligence and machine learning and all that good stuff. So
you're right. I mean, the data exists, but it's not in a form where it's usable, because it needs to be cleansed, it needs to be normalized, harmonized, put together, as you said, and that's what you're doing. And probably each organization needs to replicate that same model, so that, because everybody has that data from different patients, from different members, etc. And that's not an easy task either, right? Because there's new data coming in that needs to continuously be cleaned up, right? So is there something that you can create so that that format is fixed and it's uniform across the whole country?
Yeah, well, so FHIR is, or FHIR as we call it. It's the standard for data that a lot of healthcare organizations are using today, and is mandated that you use FHIR as your standard format. So a lot of what you would see today is, in this day and age, everyone is using FHIR R4, or at least a lot of the healthcare folks who host healthcare data are using FHIR R4. It also improves the interoperability because now you have data stored in a standardized way. A lot of the data movement mechanisms are also standardized. So there are two big standards. One is the EDI, right? So all of your member provider claims data comes through, or revenue cycle data comes through the EDI formats, 271, 277s, 278s, 835s, 837s. And then the clinical data comes utilizing, the same FHIR standards for HL7. So, we utilize HL7 and CCDA in order to transmit all of your clinical data. So, that brings a layer of uniformity in the storage, but then this is all structured data, right? If you see the numbers, 30% of healthcare data is unstructured, which means all of this clinical intelligence is sitting in the form of SOAP notes and unstructured charts. What do you do with that? Which is where I feel like there's a lot of machine learning, a lot of opportunity around NLP, around text extraction, around contextualization. We use something called Amazon. So we are on AWS tech stack. We use Amazon's TextRack to extract a lot of text from unstructured data. And then we use Amazon Medical Comprehend to extract a lot of medical related information out of these SOAP notes and charts. Now, the thing that we guys face is not all of our data is in English too. We get data in, in Vietnamese and, Korean and Cantonese. And so there's a lot of language that we have to, language translations we have to build through in our model. But I think that's where the opportunity is, Dipty. There's so much data, structured, unstructured, concatenating it, normalizing it, integrating it in a more structured fashion is something that will, that's need of the hour, and it continues to be so.
So organizations like yours would work with startups that are working on dealing with all these, creating solutions that will then help you get that data out in a usable form so that you can create a patient 360 with all of the data that is currently missing from their charts, from their examinations and everything that you have on there, right? So that's really good to know. And we touched briefly upon all the hype about AI and blockchain and cloud and technology. I mean, we see it progressing in the right direction, but like you mentioned, there's more out there. There's a lot of conversations going on how it's going to transform. I'd love to learn a little bit more about, and maybe I'm sure the viewers of our podcast would also love to learn, what are your thoughts on how this is going to pan out in the future? Where do you see AI being able to help? And what do you think its limitations would be, and where you can't possibly use AI even if you wanted to?
Yeah. Well, I see AI as an enabler for the administrators, for the clinicians, for everyone who's involved, back office folks who are involved in providing care or managing care in some way, shape, or form, right? So within artificial intelligence is pretty broad, right? So there's natural language processing, which today is being widely used in converting unstructured data to structured data and making sense of unstructured data. So there's a lot of work going on in where you would, before, you'll have like these folks who are reviewing charts, thousands of pages every day, right? Between claims and chart reviews and all of that work, which was before manual, that it was being done by an army of people. Now, one of the trends that I'm seeing is there is NLP engines which are built to ingest these unstructured charts and SOAP notes. And humans are more of a second level reviewer of what these machines identify, right? So that's one of the use cases. The other use case that I see quite often, again, in the same realm of NLP, is I was talking to this company called Robin Healthcare, and these guys are doing a lot of like voice to text and transcription. So where you would type a lot of the, electronically like type health record information and SOAP notes and encounter documentation can be done using a lot of, the voice to text. The voice to text now has improved so much over the last 3 years that there's continued tailwinds, because now it's not just your voice. Now they are going down to, emotion recognition and all of that work. So there's plenty of work going on in the NLP space. The other area that is quite deep is machine learning, right? Machine learning and deep learning. So there's a lot of work which I see going on in disease progression analytics, as you are seeing that, someone who's a diabetic, but now you see data and data points from all these different places. Oh, if someone is a diabetic and doesn't have family members at their home, has high chance that the diabetes will move up to a CKD, will move up to an end state renal if not controlled, right? So there's so many of these data points that you have in different places. Machine learning is being used to identify disease progression models, to identify ER admissions, propensity around ER admissions, or propensity around engagement. Patient engagement is a huge challenge in value-based care. So we talk about, we will align the, we talk about we're going to align our financial model. Might have the best clinical innovation model, but if you can't, in an outbound way, engage the folks out there through different modalities, you can do population health management or value-based care, right? So there's a lot of work going on in that space. Large language models, Chat GPT and everything which is coming out. language models working is now you've made a very, very intelligent chatbot, which is not unidirectional. It's not decision tree based. It's
Right.
really deep learning based, right? So there's a lot of movement which will happen in proactively engaging the members with not a person. Like our challenges, there's like a 20, 30, 50s to 1 ratio. Like if 50 people start texting a provider in an office, that the person cannot respond. But that's where you found a middle layer now, which the large language model. I just feel like there will be continued tailwinds towards building a more AI economy. It's like they say it's the third or fourth, I don't know, it's the next industrial revolution is AI. So I feel like people who are in healthcare, there's also the other school of thought that I'm also seeing is a lot of fear that our jobs are going to go away and whatnot. I mean, the fact is that we are doing so much additional administrative and junk work
True.
that hopefully
That will
with
go.
machine learning, it's going to take it over and just have you do things which really matter.
Yeah. I mean, that's what you alluded to in the beginning, that unfortunately the doctors want to spend more time with the patient, but they're not able to because of all the typing and the writing and the notes, etc., that they have to do. The AI assistant can easily help them do it. And the provider can get an assistant and the patient can get an assistant. And both burden can be reduced. The patient doesn't have to run to the doctor as often. If it can be, instead of episodic care, can get continuous care with the AI assistant. And the doctor can also make better decisions for the patient if it's not, he or she is not continuously bombarded with all these other requirements from, regulation to administrative to other things that they have to do. So bringing it back, the conversation back to startups, right? I see that this COVID had really created a situation where it was like, oh my God, we are behind in healthcare. We need a lot of solutions in healthcare. We need technology adoption in healthcare, and people need to create solutions so that we can adopt them. But there is a mismatch between people creating the solutions and people using the solutions. There's really a big chasm there. And like you said, you have to get engaged at the grassroots level. You need to really understand what the problem is so that you can create a solution, right? So can you tell a little bit more to some of the viewers who may be interested in creating these solutions, like how should they go about doing that? What is the best modus operandi, or how should they work with? It doesn't have to be just the providers. It could be the providers or the payers, whoever their consumer, whoever their customer is. How can they work more effectively to bring about better solutions into the market?
Absolutely. Yeah, see, as much as there's opportunities in healthcare, it's not easy to track in or drive change in healthcare. So as much as there's room for disruption and enablement, there's also barriers, right? To start with, healthcare is not easy, and it's not like it's not like big tech, right, where you solve it with a SaaS solution. You have to look at problems from various different lenses, whether it be regulatory compliance, whether it be process, whether it be the legacy systems which already exist. How do you integrate with them? Whether it be changing the consumer behavior. Consumer might be patients, consumer might be providers, because they've been seeing the healthcare system in one way, through one lens, right? And to change that consumer behavior. So there are a lot of these challenges which I feel entrepreneurs or startups who are looking to drive change in healthcare, they need to think through that. Obviously, one of the things that you talked about is engaging with payers and providers and working directly with them to identify the challenges. I see there are other like mediums which are coming out. The whole idea is, how do you get the knowledge? How do you get enough knowledge about the problem statement and the competitive landscape around it and barriers to entry um, to build the right solution, right? So the focus on problem has to be very, very high. Some of the things that I've been seeing in the last probably decade has been a lot of health systems or health institutions have also become investors now. So they have launched their venture arms. All the big payers have their own venture arms now. Big provider organizations have their venture arms. So and they not only invest in startups, they also incubate startups. So I think I would highly recommend, or there are folks like Techstars who are like partnering up with these institutions, or CareAsOne for the fact as well, right? I think you guys are driving a lot of this effervescence of connecting to the right end clients and stakeholders. So I think as you see raising money and identifying problem statements, if you're starting from scratch, I think these healthcare institutional investors are a great place to start, because not only do you get the capital, but you also get exposure to the right stakeholders who are looking to solve the problem. So incubating a startup with them I think that's a brilliant idea to do that. Second is, there's a lot of like these incubators and accelerators who are out there who, and I don't know if CareAsOne is part of that, where you bring in an ecosystem of folks like payers, providers, labs, pharma, hospitals to come join you. And they do a lot of like reverse pitch type work where, the health systems are pitching their problems to you, and then you're going about, solving it through using hackathons or, accelerating with minimum viable products and whatnot. So I think that's another one. Conference and events, there's plenty of them in healthcare. So go join. It's interesting. I was at American Physicians Group conference last week, and there's so much of tailwinds around, ACO and FQHCs and Medicaid getting into value-based care, which probably 5 years back you wouldn't have even thought about. Like, everyone thought ACOs are going to go away, but now it's different, right? So you go to these conference and events and you identify what are the macro trends of where healthcare is going. And once you identify the macro trends, you then go deep by aligning yourself with the right payers, provider partners, who can help you really get deep on that. So I feel like know the problem more deeply before you go about solutioning, and that'll help.
Yeah, understand the whole landscape, the ecosystem, and get connected with the ecosystem in order to collaboratively solve some of these problems. That's the way I look at it too. Yeah, so that's great. And that brings us, I know we have very little time remaining. So, we always talk about, like, we know what happened in the past and how healthcare was. It used to be these, family doctors, right, way back. And then we went into mass solving for everyone. We went into this care practices and clinics and groups of people coming together. And now we're going back possibly to individualized care again through technology. But it would be great to see, what do you think the future of healthcare entails, and what would you like to see the future to be, and how do we get there? Any thoughts on that?
Yeah. So I'm a big believer that healthcare will be virtual or hybrid and continuous. So it will not be episodic as it is today. And there's going to be, technology will be a big enabler of that. So, as you're going into value-based care, it will be really population health management, outcome-based from a healthcare provider and payer perspective. From patient's perspective, you will have like Internet of Things, Internet of Medical Things, wearables. It's going to be a constant. you won't have to, like, your watch will basically be providing data in a continuous fashion back to your providers to really identify if your health is right. The way you're going to access care is going to be a combination of virtual, which I think a lot of pandemic really enabled telemedicine quite a bit and home-based care quite a bit, which it will only continue. That's going to be the new normal. So I feel like having hybrid virtual care will be the new reality. Individualization of healthcare will be very critical, right? So as precision medicine is getting deeper, and I think your genetic makeup, your lifestyle, your environment is really going to drive how the care is provided to you. I think there will be a continued push towards value-based care from a payer and a provider and risk-bearing entities perspective. Fee-for-service is going to die in next 10 years. And there will be a lot of disruption. I mean, you're already seeing it with Amazon going out and buying, IORA and all these groups, and, Google getting into, there's so much stuff these guys are doing with Verily and whatnot. Apple is building the piping of, data. So there's big tech is going to get more deeply involved in healthcare, which is for everyone's good. I don't always agree. Like the folks who have been running healthcare, the administrators, clinicians have to work closely with tech in order to drive it. It can be, it's not a SaaS solution. You can build the next Uber or Facebook in healthcare, but it has to be a combination of providers and policymakers and payers and tech to work together. So yeah, the future is bright. I feel like there's a lot of work going on, and it'll continue to be so.
Yeah, you're right. Even in healthcare, we are so siloed with payers, the providers, the pharma, the life sciences, the investors and the startups. That whole ecosystem needs to come together, work together in order to make us go into that next century of healthcare, because we are a little behind and there's so much you can do with the technology. So thank you, Umesh, for taking this time to chat with us and discuss the challenges and opportunities and the gaps and the solutions, like you said, for building this patient-centered healthcare system. It was really enlightening for me, and I'm sure it is for all of the audience that's going to listen to this. And also the knowledge that you shared with us is very relevant for the healthcare transformation journey that we are undergoing. So, and I just want to say to the audience that thank you for listening to us. Don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned for more CareAsOne podcasts and discussions on trending healthcare topics that you care about. Sending your suggestions on speakers and topics, and we'll try to address them. And so thank you and have a great day. And thank you, Unmesh, for taking the time from your busy schedule and sharing your knowledge with us today. It was a great session. I really enjoyed it. Thank you.
Thank you. Thank you for having me on your podcast, Dipty. I appreciate it.
Thank you.